the house, but it doesn't have to be. It can be a kid, that you babysit for, or any other number of possibilities. There is this funny association between enterobius and Diantomeba fragilis. I won't get into the issue of how pathogenic Diantomeba might or might not be for diarrhea, but one thing seems to be that enterobius that does somehow facilitate the transmission of Diantomeba. Diantomeba may hitchhike on the pinworm eggs, and because we do have this fairly well-established connection between having these two infections simultaneously. When people have done surveys of rates of infection, there are some astonishingly high numbers that get put out there in some publications. I don't want to say this is true of these countries in general, and you have these huge proportions of kids that are infected, but I'm just saying there are some studies showing in some environments within these countries, supposedly non-endemic countries with good sanitation and hygiene, where we still see sometimes areas where you have these very high infection rates. Auto-infection is theoretically possible, which is the egg might hatch while it's still in the perianal area, and then the larvae might migrate directly back into the colon from the anus. And certainly this has been demonstrated as possible. We actually don't have any really good understanding of how often this happens. We don't think it happens all that often, but it is a possible explanation for. So, term little pearls, don't use the stool O&P test to make the diagnosis. There aren't that many eggs in the stool. That's not where the eggs are laid. The eggs are laid out in the perianal skin. So it is the paddle or Scotch tape test. Is the sensitivity very good? Again, very hard to know this for sure, but we think it's actually quite good when it's done correctly. And the way it's done correctly is to do the test first thing in the morning before standing up. Doing it in the clinic when the patient's been wandering around all day is generally much less sensitive. So the patient has to find a way to do the test themselves first thing in the morning before standing upright when the eggs start to fall off. Therapeutic trials are also a reasonable way to try. Using drugs like mebendazole are if it makes the perianal itch go away, well, it's probably that. There are a bunch of drugs that can be used. Mebendazole, albendazole, probably the most common, but parental also still used quite a bit and is the only drug that's officially authorized in pregnancy. Ivermectin actually tends to work. And there's this whole dogma about treating the whole family, clean the bedroom, scrub the fingernails, wash the bedroom. It's not clear how important all that environmental stuff is. But we do it because there are some cases where something's going on in the house that we just can't figure out, and we go to these extremes. It probably is not necessary to go to great extremes in most cases. In some cases, people have given recurrent treatment, say repeat the treatment every 2 or 4 weeks